This video is for any SLP who may have children on their caseload in a school or private practice who are English language learners and for whom there is a concern for language impairment. The goal of this video is to provide you with a brief overview of what research indicates is the current best practice for identifying, assessing, and treating language impairments in linguistically diverse children. First, let's talk briefly about the common challenges with identifying a potential language disorder in children who are English language learners. The chief concern here is to not confuse a language barrier for a language disorder and vice versa. A few factors need to be considered when you are deciding if a formal assessment of language is warranted. First, for how long and in what context has the child been immersed in the English language? What is the educational background of the child? Do the child's caregivers have concerns about the child's language development? What specific difficulties is the teacher reporting in the classroom, and does that match what the caregivers are seeing at home? If the child is receiving services from an EL teacher at the school, what does that teacher observe? The key is to consider as many perspectives as possible in as many linguistic contexts as possible in order to paint the clearest picture of the child's language skills. Another major factor to consider if you are an SLP in the school-based setting, and is a part of the assessment process as well, is how is the child responding to extra resources and instruction provided in the regular classroom setting? For many schools, this happens as a part of an RTI program for language. RTI is especially beneficial for this population because it gives the child a chance to show strong language learning skills that would indicate a language barrier rather than a language disorder. When there is a concern about a linguistically diverse student's language development, the best first step may well be to give that child every possible extra support available within the general education classroom. This may include a reading corner with the teacher in a small group, after-school reading clubs, writing workshops, and more. If the child is not responding to the RTI program after 6 months and concerns are still there, you want to move on to a formal language assessment. So how does a monolingual SLP assess the language of a bilingual student? A translator is necessary for children who have not had sufficient exposure and education in English. But for the child who has been educated in an English classroom for several years and is conversationally fluent in English, do we still need to take both languages into consideration? The answer is yes, because that child's language development is unique, not only from monolingual students, but also from other bilingual children, because there is a huge level of diversity to how children are exposed to multiple languages. But many monolingual SLPs feel at a loss for how to do this assessment process. While there are several methods for this kind of assessment, and no one gold standard for evaluating the language of linguistically diverse children, this portion of the video will focus on one method receiving the most recent attention from research, is showing excellent results, and is accessible for any monolingual SLP to do with limited resources. Dynamic assessment. It is a topic that is unfamiliar for many SLPs, but it is an extremely useful tool and an exciting development in our field. There are many forms of dynamic assessment, but the basic structure of any dynamic assessment consists of 3 steps: test, teach, retest. The most familiar form of dynamic assessment is in fact RTI. RTI is very common in the public schools. It's a more informal and drawn-out form of dynamic assessment because it takes place over several months, whereas other dynamic assessments can take place in 2 therapy sessions. Other types of dynamic assessment utilize subtests of common language assessments. For example, the dynamic assessment of sentence structure, or DASS, assesses syntax and was developed by Natalie Hassan and colleagues. The DASS is actually taken as a part of the sentence assembly subtest of the self. The DASS was found to be highly predictive of language disorders, although it should not be used alone. There are many procedures of dynamic assessment, both formal and informal. If you are interested in learning more about specific methods of dynamic assessment, one potential resource is the manual Dynamic Assessment of Language Learning by Natalie Hassan. Why dynamic assessment, though? Why would one go through the effort of learning a new method of assessment when pulling a norm reference standardized test off the shelf is so familiar, simple, and widely accepted and practiced by most SLPs? First, dynamic assessment is worth learning because research tells us that it is more effective than standardized tests. Standardized norm reference tests are not normed for bilingual children. The norming samples for English standardized language assessments are not linguistically diverse. Therefore, you cannot fairly compare a bilingual child's score with a norming sample's performance on the test. Dynamic assessment actually cuts through all of those confounding variables, such as ethnicity, language exposure, education, gender, socioeconomic status, and more, because with dynamic assessment of language, we do not care as much what skills the child has right now. We care about that child's ability to learn language skills when provided with measured instruction for a certain duration of time. Let's briefly talk about intervention. Again, there is no single gold standard for language intervention with English language learners. It is important for you to consider your unique context and what the child's needs are. In most cases, if the child is being formally educated in English, language intervention in English is just as beneficial as dual language intervention. This is great news for monolingual SLPs who work in a linguistically diverse population. You need to use proper judgment, however, to know if there is a language barrier present and if the child has not had enough exposure to English and a translator is needed for all of your sessions. In conclusion, research is always emerging about how we can best serve English language learners in an effective, non-biased manner. This should not be intimidating for clinicians, but rather empowering, because by using these practices, such as dynamic assessment and collaboration with parents, teachers, and EL teachers, we can be more confident in our clinical judgment. I will list some resources at the end of this video that expound upon the ideas presented here. But know that there is a wealth of research to do on this topic. Thanks for watching. Here, I've listed some podcasts that I found to be really helpful, especially on the topic of dynamic assessment. All of these are available on both Apple Podcasts and Spotify. Thank you so much for watching. I hope you found this video to be informative and helpful.